My advice would be to, consider COVID-19 as a public health emergency of international concern, as WHO clearly reaffirmed that classifications of the disease has not changed. And as African countries, I think we really need to learn from history where, in the past, some diseases that are considered to be diseases of, the Northern Hemisphere have led to huge catastrophes. A case in point is HIV pandemic. So it's really important to make sure that we do not lose, sight of the goal. In my opinion, it is really important to make sure that we have clear goals, which is, to slow and stop the transmission of COVID-19, to, prepare the health systems as much as possible to provide optimal care to those who need it, and then to obviously to minimize the economic impact. It is clear that economic recession in our part of the world, in Africa, kills children, kills people. So it's a false dichotomy to make choices between public health and economic performance. They are, integrated, and both lead to loss of human lives. So I think it's really important to make sure that ministers approach this issue, the preparedness towards containing the COVID-19 in Africa, with a whole of government approach. So, the decisions have to be evidence-based, and, they have to make careful decisions in terms of the trade-offs between some of the public health measures that are taken to slow and stop the transmission and the potential impact and consequences in delivery of essential services, including, ensuring that people have, their means of subsistence. So, in short, my answer would be, we have to consider this disease as a serious public health problem, could potentially have an impact in Africa as it does in Europe and the US. So we have to do everything within our power to slow and stop the transmission, prepare the health systems for optimal care, and minimize the economic impact. And this has to be done through a whole of government approach where decisions, particularly the public health measures, should be done with careful consideration of the trade-offs that we make. There is this saying that don't waste a good crisis, right? So crisis provides an opportunity as well. So in my experience and in my opinion, I think it's really important to make sure that the public health system, particularly the primary health care system and the community component, should be properly strengthened. This is really important. This is an opportunity that could not only position our countries in a better way to control the spread of the outbreak, but at the same time it also ensures that there is community engagement and empowerment in ensuring the continuity of critical services. This is not the time to interrupt essential services. This should be the time to really build a responsive health system. And this crisis and the political focus, attention, And engagement of the community should really give an opportunity to rally, support in building a very solid foundation, particularly using our community networks, our frontline workers, and the primary health care system to really set up, a responsive system that, basically reach every household with critical information to create awareness. Will be mobilized, this community infrastructure will be mobilized to create, an army that could help the health system in identifying potential suspected cases, not only for COVID, but for all other diseases that could cost many, many lives. An example would be the likes of malaria and measles outbreak, severe acute malnutrition. All these will have a really serious impact in vulnerable children and households across the community. So when we engage and mobilize the community-based infrastructure, we have to make sure that we are also using this infrastructure, to create awareness, to identify, vulnerable households, suspect cases, and to facilitate the linkage with primary health care system. And we have to create a system of, routinely, getting data, analyzing it, at the lowest level possible, and use that information to, rapidly make decisions and respond to issues. This kind of responsive nature analysis and database decision making, even at the lower level of the system, would create a conducive environment for, stronger engagement of the community. So, yeah, my answer would be, we have to make sure that we use this crisis as an opportunity to really strengthen and lay a solid foundation that could be used to slow and stop the transmission of COVID-19, but at the same time can also be used in parallel to address critical services and needs of the community. I think the key element would be to make sure that the head of government is fully on board and understands potential risk and the importance of the various actions that needs to be taken. So it has to start from the head of government. Obviously, my experience and the best experiences I have seen elsewhere is, a routine which is usually, a national coordination mechanism, which is usually chaired by the head of government. The health sector could serve as a secretariat, but it is really important to make sure that all relevant line ministries and stakeholders are represented in that national coordination mechanism. So that's very important to make sure that there is that national coordination mechanism chaired by the head of government, and ensuring that there is a regular review of the progress and the preparedness. The second important piece, which really ensures cross-government collaboration, is to have one overall government response plan. This is easy to say it than to get it done, but it is really important to make sure that governments have a coherent national preparedness and response plan that looks at the different strands of intervention and actions that needs to be taken. This will also ensure that there is alignment and harmonization of the various actions that will be taken. And the third important thing is to really simplify the interventions in a manner that can easily be understood by anyone. We are talking about a health crisis, in COVID-19. Some of the things that need to be taken, such as, the isolation, the testing, the contact tracing, the surveillance system, it has to be communicated in a language that is easily understandable by the communities, the political actors, and so on. So I think simplifying the message is also very important, and I think it is really important to have that open communication with all the aligned ministries, and to have that reflected within the sectoral technical working groups is also important. So have a coordination mechanism both at the political and technical level, cross-sectoral, have one plan, make sure that that plan is aligned and harmonized with specific sectoral interventions, simplify the language, make sure that you have clear evidence-based decisions and interventions captured in that plan will really make the cross-sectoral collaboration much more smooth. But it takes that human touch of regularly reaching out and ensuring that that communication line is open is important. And in big countries where there is some sort of federalism or decentralization and devolution of power, it is equally important that there is clear alignment and harmonization between the central governments and the provincial or the state level governments. That's also really important. I think we as a country, one can be as strong as its weakest link. So you may have a very strong national team, national plan, and national interventions. But if you have a regional state or a district that is not ready, aligned, or harmonize its actions, the country at large would continue to be at risk of facing the dire consequences of the disease. So that's also important, harmonization and alignment with the different levels of government in a country is important. I hope this would be an opportunity that governments learn to make sure that the right investments are made at the right time to build as much as possible a resilient and strong systems, not only within the health sector, but broadly with the areas of human capital development. I think there is no better time to really emphasize on the critical importance of investing in human capital. Look, with few exceptions, in the African continent, if you look at all the critical innovations, interventions, productions of equipments, test kits, PPEs, all of it is manufactured, elsewhere. There is little capacity within the African continent, and this shows the long-term, lack of investment in, human capital, among other things. The intensive care capacity in many of the African countries is, very, very low. This also shows, how far as a continent we have to go. But it is not about equipment. You need human resources more than what you need in terms of equipment. So, the population to patient ratio, to doctors and nurses ratio, the skill mix of health workers in different facilities is something that needs to be improved. So I think, post-COVID, it is going to be difficult, obviously, but it is really important to make sure that, we, as a society, leverage our existing infrastructures, mainly the social and community infrastructures we have, try to create a system that can identify, detect public health emergencies, create, solidarity within communities to ensure that there is a robust, social protection systems. But at the same time, you need to make sure that the right investments are made at different levels of governments as well, and systems as well. So governments have to play a critical role in really ensuring that, in asking the right questions. Are we making the right investment? Is it a wise investment? And those kinds of decisions have to really be made, as part of the post-COVID response. And I hope we will not waste this opportunity of learning from this terrible, terrible crisis, but use it as a springboard to build, a good investment to boost the human capital of the continent.